Welcome everyone to the fourth in our series of COVID-19 media dialogues, sponsored by the East and Southern Africa Region Risk Communication and Community Engagement. And this one's called COVID-19 and Young People. What's the story? My name is David McDonald. I'll be a co-moderator, along with Tole. Tole, why don't you say hello?
Hello, everybody. Thank you for joining us. My name is Tole Nyata from the Internews Regional Office in Nairobi.
All right. And the first thing I wanted to do was just welcome you all. We have a lot of really interesting information that we want to go through today. I wanted to first just let you know about how we get the feedback that we base a lot of this on. If you're not familiar with SRRCCE, we love acronyms, don't we? As you can see in the slide, they try to find out the main trends of the feedback. And what's kind of nice about this is that they have a whole bunch of different partners involved in getting feedback, and then they put it all together, and that's how they get a good idea about what are the top things, what's trending, what's the most important for the people in a variety of communities and a variety of countries, as you can see in the bottom. So that's why we're very grateful that we can get this access to this data, and we also hope that you, as journalists, realize that there's lots of good data out there that you can use in your stories, and get a hold of the RCCE, get a hold of OCHA, get a hold of a lot of these organizations. They'd be happy to help you out with some good data. And I'm happy to say that we have two awesome presenters today. Kijala Shako from Save the Children and Kate Thomas from Internews. Tole, did you want to tell them about the poll that we have open?
Yes, we have a poll open which has been set by Christophe. It's an anonymous poll, so we want to know who answered. We'd like to know the age groups of all the participants. So please take the poll, and there'll be a second one later. And I'd like to kick the ball rolling with Kijala. Kijala, can young people get COVID-19?
Yes, they can. Contrary to popular belief, young people can get COVID-19. The extent to which they are impacted, the extent to which they can spread it is not so well understood yet, but they can get it and they can spread it. And I think as we start, I just want to clarify that young people are not a homogeneous group. And so I will just start by trying to profile some of the young people that we believe are most vulnerable. So the first category is girls. The second is children and young people living with disability. The third are children and young people living in areas affected by conflict. And the fourth are refugee and IDP children and young people. Next slide, please. So I think the other thing that is important to point out is that when we're talking about youth and COVID-19, their infections and their interaction with COVID-19 is not happening in a vacuum, but it's happening in an environment where COVID-19 has come to further exaggerate the inequalities that were already existing between rich and poor, between young and old, between men and women, and this just becomes worse as a result of COVID. The other thing is that we are having young people coming into contact with COVID in an environment where already a lot of the resources are overburdened. So whether it's the health resources, whether it's their routines, whether it's education, this has all been disrupted. And then again, when you break down the diversities within young people, you still find them making the majority of Africa's refugees and IDPs. And there's a grave danger that a lot of the development that the continent, and particularly the East and Southern Africa region, has seen are likely to be reversed as a result of COVID-19. So we're also having this happening when there's a lot of hunger. Currently, most of the region is flooded. So all this is just exacerbated by COVID-19. And I think that is it's the context that I wanted to set. Next slide, please. Again, when we talk about young people, there's a lot of confusion about definitions, who's young, who's not young. And so when you go through different normative frameworks, you find the UN considers young people between 15 to 24. The Africa Youth Charter is looking at young people between 18 and 35. most of our national legislation and constitutions are looking at young people up to 35. And then we have sociocultural definitions. When you get your menses, when you're circumcised, when you get married, when you get a child, and all that comes into play. Kate, I'll hand over to you.
Thanks, Kijala. So, as journalists covering health, our work is to turn science into stories. So how do you cover the topic of COVID-19 and young people as a journalist covering health? And the answer, of course, is that there are many ways. So you choose an aspect that interests you and you start from there. Here's an article, actually an opinion piece published in The Conversation South Africa. And I've pulled this out because although it focuses on Nigeria, the authors, all of whom are Nigerian scientists, write an opinion piece about the findings from a study that they did. And they actually found that in the COVID-19 outbreak in Nigeria, there were more young people affected as compared to older people. And this was different to what we're hearing. This was different to the global trend. And one reason for that might be that in the international media, we see a lot of stories coming out of the US and Europe, where it's true that older people tend to suffer more severely from COVID-19. But in the African context, in most sub-Saharan African countries, as we all know, there are more youthful populations with a lower median age. So of course, we're going to see cases happening in younger people. So, we've talked about the ways in which young people are indeed vulnerable to COVID-19. And here I've made two lists of the different ways that COVID-19 affects young people. So the first list is in the medical sense, and the second is the more indirect social, economic impact of COVID-19 on young people. So to start with the first list, we have the symptomatic cases that we know about. I think everybody knows by now the symptoms of COVID-19 and the ways that that affects everybody, including young people. We also have asymptomatic cases, which, studies are still ongoing on this as well, but we do know from preliminary research that there are many cases of COVID-19 in young people who are healthy, and therefore we are seeing asymptomatic cases, in which case they could then spread it to others, which we'll cover in a moment. We also see in children and young people rare and acute cases of COVID-19 that we don't quite understand yet in the science and medical realm. One of those things is something called multi-system inflammatory syndrome. There have been initial reports of findings coming out of South Africa where we have seen cases of this in children and young adults. And typically that presents with a rash, a fever, symptoms that don't go away, sometimes blood clots. And it's something that's particularly seen in young people. So although it's very rare and young people are unlikely to get that, it's something we should be aware of in terms of how this disease can affect young people in ways that perhaps it doesn't affect those who are older. And then next we have long COVID, which is the name for long-term symptoms of COVID-19 long after people are expected to have recovered. So that can mean anything from ongoing fatigue, tiredness, to rashes, to skin symptoms, to more complex cases. And again, that's something that's not fully understood, but we are seeing that in young people as well as older people. That can also have implications on the muscle surrounding the heart, for instance, which has been seen in younger athletes in the US. So when we're reporting about COVID-19, it's not just the initial acute phase of the illness, but it's also interesting as journalists to look at how it's affecting people long term. And speaking of long term, we also have to look at the mental health effect, the psychosocial effects of this, which can include trauma, other impacts to mental health, depression, anxiety, especially if, this illness is happening to people in a very stressful situation where there have been lockdowns, impacts on the economic situation at the same time. And grief too, I've put there because young people also may experience that if somebody in their family has unfortunately died from COVID-19. And then I've also included medical unknowns here because scientists are still working to understand the full extent of COVID-19, and that, of course, impacts young people. And as we have a vaccine ready and as vaccine efforts continue, there will be an impact on young people in terms of vaccination equity. All those things are good to look at.
Kate, if you don't mind, if I can just jump in quick, I have a question here that perhaps Kijala or you, Kate, could deal with, which is from Adera Owino. You're listing all of these things that are very specific, scientifically documented medical impacts of COVID-19, yet we keep getting these questions about, and I'll read her the question here, is corona still there? Because when we urge our listeners to take precautions, they say that hakuna corona. How do you answer with the hakuna corona? Kijala, why don't you take that one?
I think for a lot of our communities, because of the other challenges that Kate has listed on the right-hand side of the screen, because of the social, economic, and indirect impact. In terms of priority, then we are finding communities have deprioritized COVID because facing up to its existence or admitting that it exists means they can't go to work, means they can't engage socially in the ways that we are used to. It just is a very disruptive effect on the lives of many young people and their families. And then the second thing is the confusion around symptomatic and asymptomatic. So not very many people have interacted with severe cases. So again, I think that means that the level at which they take it seriously is much lower. Kate, any other perspective?
Yes, completely agree. I think that's what's happening there. And I think we are still seeing cases of COVID-19, even if they are not most front and foremost in people's minds. So I think it's really important to always remember that it is there, even if it's not something that people are prioritizing thinking about.
Great, thank you, Kate. And Tole, if you see any questions that jump up from the chat group, just jump and let them know, because this is a dialogue. And let me just add that part for all you attendees. Thank you. I hope everyone's there and listening. And if you have a specific question, there's the Q&A part or the chat. Put it in there, and if it's for either Kijala or for Kate, let us know, and we'll try to get to your questions as we move along. So, Kate, I think we're up to the social, economic, and indirect impact of COVID-19 part.
So we have, of course, as Kijala has also talked about, we have so many ways in which COVID-19 affects young people that are not to do with the actual medical disease there. Okay, so first one is the impact on access to essential health services. Young people, as we know, need to access health services for other reasons, whether that is to give birth, whether that is for other conditions they may have, diagnoses that are pending, to collect medications during lockdowns. All of those things were much harder for young people to do. The second one being education, school closures. That has affected young people in a massive way, as we all know. The economic impact, food insecurity, lack of money, jobs, family support. What happens to young people when their families have no way to go out and earn daily bread? How do young people then have to transition into breadwinner roles? We've seen that happening in many communities. Even something like access to tech, when I think we've seen in a lot of higher income countries that things are moving online. People are having Zoom calls, these webinars, and in many remote or rural communities, young people don't have access to tech to join those meetings. So we see something like lockdowns happening, which may have been more successful. We can debate that in a completely different webinar in perhaps, some countries where there is access to tech and people can switch easily online, but in rural communities in Liberia or Malawi, for example, that's much harder to do, and that affects productivity. And then the last one, young people as caregivers, clinicians, and helpers. Young people who are working in healthcare roles have been affected by this pandemic in ways that, unimaginable ways, as well as those who are caring for sick people at home or young people who've decided that they want to be part of the response to this pandemic and have gotten involved in whatever ways they can, whether that is social and behavior change, whether that is by making songs about it to help their communities understand what's going on, whether that's coming up with innovative solutions like making face shields. All kinds of creative ideas have been happening. So I think it's not only the negative way that this has affected young people, but how young people have really risen to the challenge of tackling this is another way that it's affected them. So how do you cover these topics as a journalist? There are two approaches. You can either start with the data, or you can start by interviewing people in your community to understand more about how they're being affected. And of course, you need to do that in a safe way, given the risks of COVID-19. So for example, if we take the topic of education and look at how to approach that in an interesting way, here is an interview that I recorded yesterday with Gloria Tamba. Gloria is a young Liberian journalist in her late 20s, and she's a TV reporter for Spoon FM TV station in Liberia. She specializes in health and gender. So during the peak of the COVID-19 outbreak in Liberia, during the lockdown actually, she reported an investigation into the impact of this illness on female students. She didn't actually know what the impact would be when she started, but she found through her reporting that there were ways in which this outbreak was changing the behavior of young people that she found especially important for people to understand. So if we can play the video and hopefully the subtitles come up.
What happened was after the issue of education, order the closure of all schools, we started to look at what next parents are doing in order to help kids. So kids that are at home, what is the government through the Ministry of Education doing in order to keep them at a point wherein they will continue to learn at home? And so this makes us start going out there, especially we had to go out there because I do a lot of reporting on women, especially sexual and gender-based violence. But since I'm always there reporting on these things, we started to go out there to interview the women, or especially the female students, on how do they feel about being out of school at this crucial time. And so majority of them, based on the way in which they respond to the questions that I asked them, they were like, some of us, we are the ones paying our own fees. Some of us, we are not able to do this. We are not able to do that. We have to pay attention to our family. Since school is closed and our parents are not working, we have to do things that will help us to keep the family going. So my question was, what are some of those things that you are doing in order to keep your family going? And they were like, we have to go out there, we have to sleep with some people for them to be able to give us money. We have to just do whatever we're doing to get something to feed our family. To be getting something to feed our family, we have to go out with boyfriends. Once we go out to club, we get someone who will help us. If we don't go to club, we'll start to sleep with those boys that are in our communities. And once they are around, they'll be able to help us with whatever they can, because we are not working, we are not doing anything. At first, once we are in school, we have to focus on whatever we are doing when it comes to education. But now, life is so boring, there is nothing that education, there is business, there is no job. So we have to all to save ourselves. So in my own way that I was able to report this, I had to, basically protect my image, or image in the sense that I didn't mention names in my report, or I give different kind of names so that people can really know who they are. And so I got in contact with some of them. So because of this COVID-19 pandemic, a few of our friends are already friends.
The reason I shared the video about Gloria's experience reporting this case was that I think it's important to look at when we try to begin our reporting to understand how young people are being affected by COVID-19, I think her approach is interesting because she looked at, well, what's happening to these young students when they're not able to go to school, when lockdowns have forced an economic hardship onto their families. And what she found was that some of them were turning to prostitution. There were actually more than 900 cases of rape reported during the COVID-19 lockdown in Liberia, and at least 16 students became pregnant from the community that she reported on during that time. So those are things she wouldn't have known if she had not begun that reporting to understand the impact on her community. So I think it's a good example of looking at ways to approach a story and ways that stories can turn into big investigations as well.
I'd like to interrupt a bit. I'd like us to move to the chat. There is an answer from the earlier question. We have Sophie from the RCCE Collective Service answering the question asked earlier by the journalist through David. And she says one of their key recommendations to journalists to help address the belief that COVID-19 doesn't exist or that the pandemic is over is to share stories of normal people who have had COVID-19, talking about the experience of overcoming the virus. They should be portrayed in a positive light to avoid stigmatization. This may help to break down the misperception that COVID-19 is only the disease of the rich or only affecting people living in certain countries. For example, we would love to see examples of this in your work. Please do share them. That's Sophie from IFRC. We also have Taban. Thank you very much, Taban from Southern Sudan. Taban says, my approach as a journalist is I always take my personal time to interview the doctors as well as the National Ministry of Health. Remember, you can ask your questions on the Q&A or the chat. Back to you, Kate.
Great. Kijala, do you want to step in for our next section about are young people aware they can infect others?
Yeah, and I think as you move to the next slide, I think Kate has brought out an interesting point where, again, when we're looking at young people, the impact is different for female young people and male young people. And it's right to point out some of the challenges that particularly young women are facing. And she has rightly pointed out rape. We are having more and more young girls being forced into early marriages. Young people sort of have a head knowledge that they can spread COVID, but I think the social pressures, peer pressure is really impacting on how they respond, on how they act responsibly or not. And I think that's the biggest challenge. So in terms of reporting, I think, Kate, you have a number of examples. We need to have a lot more targeted reporting towards young people in informal settlements, but also alongside the information, also putting in place sufficient supportive mechanisms. So one of the things we're actually advocating and campaigning for is around government-funded social protection programs. That then if we are telling young people who are breadwinners not to go out, to sort of be in seclusion, to minimize interaction with others where they are likely to spread the virus, then we need to give them options that allow them to also meet economic requirements, where we are telling young people to stay put, but they're in circumstances that are violent. Then what kind of protection mechanisms are we giving? What kind of support is available for them? Criminal justice, safe houses, what kind of mechanisms are we able to put in place? Are we able to give around dignity kits so that then girls don't have to go into prostitution to meet their hygiene needs?
Thank you very much. We're up to our last part here about the what should young people do, and before we jump into that one, we appreciate your questions and we hope that you can follow up on all these things. The presenters will be available to answer your questions later on, but the big part that we're trying to emphasize for you journalists is to go away from this media dialogue with some practical tips on how you can move forward and really cover the story better. Tole, do you have anything you want to add to that at this stage before we take our 1 minute break?
Yes. We have Angela, who says, in Kenya as well, we have witnessed an increased cases of gender-based violence at household levels. So yeah, situations seem to be different, the challenges that ladies and men are facing. So remember, you can continue asking your questions through the Q&A or the chat as we go along.
Excellent. Okay, and if you have any more, just let us know, Tole. So what we also do right about now is, because we're talking about health, I mean, this is all about COVID-19 and how do you stay healthy, is now that a lot of us have been working remotely and sitting in front of a computer screen and doing everything virtually, what's very interesting, and this is a comment that we get all the time from all kinds of people, journalists, anybody, is that people are spending a lot of time in front of the computer and they're not moving, and they're just kind of sitting there for a little bit longer than what is healthy. So what we do right about now in our media dialogues is we're going to play a little song and encourage everyone to just take a break, put your headphones down or whatever, and just get up and move around, get your circulation going. It's just a 1 minute kind of thing to get everybody moving, get the brain freshen up, maybe think up some more questions. And also, we are going to be opening the poll for that we put out right now about what topic would you like to have us talk about at our next media dialogue, which is in 2 weeks on the 7th of October. That poll will be open for you momentarily. So I'm going to switch over to a song that was produced about COVID-19 from our friends over in DRC. Like I said, time to just take a quick break, 1 minute break, get up, move around, and get the blood circulating, okay? Here we go. And let's see if my DJ skills are a little better this time. They're pretty lousy last time.
Wana obateli ekolo mobimba virus oyo mabe ezosilisa mokili me tobanga te respecte ba principe d'hygiène po tolonga yango maladie au mabe. Arrêtons sa propagation en restant chez toi. Batela baninga.
C'est bien de se laver les mains. Ça serait mieux de se nettoyer l'âme. C'est bon.
Alrighty there. Well, I hope you enjoyed that the little break. And I hope your blood is circulating and fresh oxygen is getting up to your brain to come up with some more awesome questions for the second half of this media dialogue. And I want to, besides encouraging you to ask questions, remember that we'll be sending out some more information, fact sheets and stuff like that for you to work on. But again, think about practical tips, practical steps that you can take right after this media dialogue to start your story about how to cover young people and COVID-19. There's like so many angles to the story. If it's overwhelming, no problem. Let us know and we'll help you out. That's what we're here for. So the poll is open. There's a bunch of topics that we want you to consider. You decide what we're going to talk about. You decided this one last time we did it. So go for it. All right, so let's get back to the slideshow. What do we do now? Let's see who's up first. It looks like Kijala. It's time for the way forward.
Thank you, David. I think as we start with the way forward, we've clearly agreed that young people cannot do it alone without the system or the government supporting them. And so I think as our governments are continuing to try and make the choice between development and stopping the spread of the pandemic, balancing that with economic considerations, then they also have a role to play. I was reading a research earlier today where it was saying that in the course of the pandemic, young people are having a much harder time continuing to enjoy their rights, the right to information, the right to association, right to access healthcare, right to access education. So I think this is the first thing that governments need to make, that in whatever decisions they make, they're ensuring that the rights enshrined in different policy and legislative frameworks are observed, that in their response, they are doing no harm, so not using very militant ways, using force to enforce the requirements. Look at how response plans are taking on board young people. How are we involving them? How are we involving girls? How are we ensuring that children in the most remote areas and young people are being accessed? And then also the last philosophy is around looking at what are the long-term needs of children in terms of development. And so this is where now the social protection comes in to protect children and young people from any future shocks. So in terms of what I found young people have done, they've been part of service delivery, distributing soap in different communities. Young people have been at the forefront of educating their communities, whether they're in the refugee camps or informal settlement. But we're also saying we need to see more and more structured support networks for young people. We've seen their mental health suffering. We've seen some are suffering through grief, depression. And so that needs to be taken into place. And then even as young people are engaging, make sure that they're diverse groups, they're integrated groups that have both male and female young people, so that different voices, different needs are taken into account. Look at how to expand civic space. I think in terms of the COVID-19 response, we've seen a lot of clawbacks in terms of rights as governments have tried to stop the spread. And then in terms of accessing technology, seeing how young people at the forefront of technology can expand this even more. Next slide.
Well, Kijala, if you don't mind, let me just jump in quick, because there's another question that came through prior to our media dialogue, and again, this is I don't mean to put you on the spot, but some of these suggestions, they require money, and there's still there's a perception out there that the whole COVID pandemic is, if not a hoax, it's just a way that some governments are using it to get money. How do you approach that if you're out there, if Save the Children is asking for donations to do something like this, when you get the response of or the attitude that they just want to give money to corrupt governments? What do you say to that?
I think for me that is why when I was looking at where young people can act and how they can act, the issue of civic space becomes very, very important, and accountability. So I think we've seen, as a result of good journalism, a lot of exposés and investigations that have demonstrated that resources given for COVID-19 response have not reached source, have not reached the main beneficiaries. And it's part of the reason why communities, young people, actually don't believe that COVID-19 exists. Because I think the response that is being expected, the resources that are intended to be going into the response are not visible. But I think for all of us who've been youth activists, there's a lot of endeavor that young people are able to do even without resources. And this is not to say that no investment should be given to support them, but then young people are sort of natural organizers. They already congregate in common areas. They already have much more access to information because they have tech, they have mobile phones, they play soccer. So they are constantly congregating in ways in which they can access the information. So definitely the corruption has given COVID-19 a bad rap. It's really killed trust and the social contract between governments and the people. And I think that conversation needs to be ongoing. Yeah, unless someone else has something to add, I think that's part of the reason why the communities don't believe, young people don't believe COVID-19 exists.
What you just said, that young people can be part of the solution, can be part of how to stop this pandemic from spreading. How young people can hold governments and other NGOs and everybody else accountable for what's going on. That's a pretty bold statement. I mean, do you think the young people are capable of that?
They are more than capable. So I'm looking forward to seeing how we can spur that, because I think anytime there is more citizen-driven demand for accountability, then we do see much more accountability. Once Kate is done, we can come back just to look at how, even as journalists are interacting with young people on COVID-19, we can put into place safeguarding modalities.
The first thing I wanted to say was that, as Kijala said, I think young people, despite all these challenges, young people are showing up as leaders in this space. And that's something that is really an opportunity to both, be part of as a young person and to write about as a journalist, or to report on as a journalist. And I also think that the issue that Kijala mentioned, talking about corruption, about the ways in which funds are definitely not distributed equitably, that's a story in itself too, because there are lots of young people who want to be part of the solution, who have ideas, but who may be locked out of the financial system that can help them do that, and there are more and more grants available for these kinds of projects, but of course that can be challenging and competitive. But I think, that's also a story too, the ways in which that link between why people may not believe that COVID-19 is real and the ways in which the money system kind of flows, so lots and lots of scope for reporting there. And some of the most exciting journalism out there is both by and about young people. And I really think, of course, young people are experts on young people. There's no one better to write about the amazing work that young people are doing than other young people. So, as young journalists, I think you're in a really special position to be able to do that reporting. There are lots of innovative stories to cover about interventions and ideas by young people. A few examples. So one of them is this app called the RADA or RADA app, which was developed by students at the University of Nairobi. And originally it was developed to share information on sexual and reproductive health with other students. And it's now expanded to mental health and COVID-19. So that's a pretty cool story. And this RADA app, they're also doing Facebook Lives and, online events featuring everyone from musicians to medical doctors that students are involved with. So it's both a way of students accessing more information, young people being part of the solution, and really just improving access to information that's produced and created by young people for young people. So that's really important. There was another example, which was an organization called Draufsicht. I don't know if I'm pronouncing it correctly, but this is a Cameroonian-German filmmaking collaborative. And this was happening before COVID-19 started, but basically filmmakers in both Cameroon and Germany came together with the idea of collaborating on filmmaking projects and really learning from each other. So these international partnerships are really, really significant in the time of COVID-19, because there's practically no country in the world that hasn't been affected by this pandemic. So it's something that can bring young people together no matter what country they're from, and really they can share experiences. So these exchanges are happening online, in the creative and musical spaces, and as we see with that example, in the filmmaking space. And the last example, something called the Teenage Reporting Project. And this is an initiative that links teenage reporters, teenage journalists with media outlets all over the world to report on issues that are affecting young people. And they're pretty active during COVID-19. For example, they have had journalists in India write about developments happening with new tech there. There was a school in Beijing that paired teenage filmmakers with a media organization. So together they made a film about the pandemic. So I would urge you to check it out because there's lots of really exciting projects there. It's called the Teenage Reporting Project. And then on this last slide, I've included this Africa Innovates report that came out from the UNDP, which I'd also suggest you having a look at because it's got lots of ideas for, it's calling it, it's on the screen, 50 homegrown African innovations tackling COVID-19. I mean, I was reading this and really enjoying learning about all these ways, they're calling them disruptors, game changers, the young and gifted. And it's really exciting, all these ideas that are coming. So even, I think, the beauty as a reporter is that even if there isn't funding for an idea or it hasn't got off the ground, you can report about the ideas and the potential they have to make change. The first one is out of Madagascar, and this is a young woman who won a prize at the Madagascar Global Hack for creating a no-rinse soap, which is a brilliant idea in communities where access to water is not easy. So there is a soap that she's created that you can use, and it's made using oil, so you don't have to have water to use it, which is brilliant. Another one, just going clockwise, so the second one to the right, is a student at Kenyatta University in Kenya. He came up with a 3D printed nasal swab for COVID-19 testing. They're affordable to produce, they're less invasive, I believe, and it's something that has the potential to be scaled, and it's a Kenyan solution, so that's brilliant. And then in the bottom left corner is this is an idea out of the Republic of Congo, which is a full body sanitizing station or a disinfectant chamber developed by a 29-year-old in the Republic of Congo. So I'm not quite sure how it works. I imagine you go in there and you just get sprayed down with disinfectant completely. So, lots of really exciting, interesting ideas to explore. All of these could be great ideas for stories. And I think, my last point I wanted to say is that these are just the stories that have received major media attention. And there are hundreds of hidden stories like these in every community. And some may be directly linked to COVID-19. Others may be things that were happening before, ways that people have pivoted to responding to COVID-19, or just the ways in which this pandemic has slowed down the development of other ideas and other innovative ways. There are so many ways to approach these as journalists. And as David says, we are here for you with any questions or ideas you might have, to sort of talk these things through in more depth. Please don't hesitate to reach out. But I think, the challenge might be that there's so many places, it's sort of knowing where to start. But my advice would be to start somewhere that interests you and to go from there.
That's excellent. Thank you very much, Kate. And since we've been talking about youth and young people in journalism, perhaps we're going to spend the last 10 minutes here. Tole, do you want to take it over and let us know about a young journalist?
Yes, please. Before we move to the next segment, where I will introduce a journalist who's passionate on doing stories about young people, who he will be sharing quickly what the stories are and what the bottlenecks have been. Before we get there, we have Cool. I hope I pronounced it correctly. Who says young people in my country ignore existence of COVID-19, thus they gather in large numbers and the government isn't doing anything, claiming there is no funds to create awareness, and young journalists are denied information to educate young people about COVID-19. In this case, what can a journalist do to help others out through his or her journalism work?
I think that's a really great question. I think that's of course a challenge when there is not the access to information that everyone deserves to have. The great thing is that there is always access to information online that is, focused on the impact of COVID-19 on the body, certainly covering the medical aspects. And now, of course, that may not be country or context specific, but there are always resources like WHO, like CDC. Of course, we have Kijala from Save the Children. Internews has resources online. So there are, widely available resources online that journalists can use for figures, for data to support your reporting if the government is not giving out those figures within your context, But I think also you can focus on the ways in which that is impacting young people, because that's a story as well, lack of access to information. How are young people responding to that? What are the challenges? And even just, calling attention to it, if you feel you're able to do that in a safe way, then I think that is part of the solution as well, So I think that's important to remember.
Thank you. Now to Thomas Bwire from Kibera, Nairobi.
Thank you so much, guys. My name is Thomas Bwire. I am a journalist based in Nairobi, Kenya, Kibera slums. I work for a platform called Habari Kibera. It's a media platform that focuses on telling community solution-based kind of stories on governance, health, education, and human rights and environment. And basically just to share my experiences in how I've reported on COVID during this time of the pandemic. That first when it came, all of us were caught unaware. So through some mentorship programs through Internews Kenya and Media Council of Kenya, so some of us were able to now understand how can you also report, putting also our safety first. So we had to think about interviewing sources through a phone call. Just make a phone call from your home and record the entire interview, maybe on audio, and then you're able to file your story, especially for radio journalists. And also for ones who are doing multimedia story, for example, I could ask my sources to record, just give them guidelines. So you ask them to record a video from their side if they have a good smartphone, and also through a help of a friend. So they record a small video from their side and send it to you, and then you're just able to edit the content on your side so that you share it to the other audiences. But also the challenge was at some point you find that maybe other sources are not able to access data to be able to send you that information back. So sometimes you're just forced to walk to the location and meet them physically. So that was a bit of a challenge initially, but at some point it worked a bit well for me. And maybe some of the issues that I've also tried to see, especially with the young people, in the slums, in Kibera slums where I come from. I've seen the issue of the teen pregnancies that has been critical, because now kids came back from school, they have so much time on their disposal. Some parents also lost livelihoods, they lost an income, regular income. So it meant that they had to supplement. So they have to look for other alternatives, for example, go out and look for more casual jobs, in low income areas, because there was the issue of the stigma that people coming from Kibera had COVID, because at some point the Ministry of Health was reporting COVID numbers from Kibera. So most people were fearing to employ, especially those women who wash clothes in high-end estates, and also the men who go to the construction sites. So we are being stigmatized in a way that we don't want to employ people from Kibera because you can transmit this virus to us. So parents had to look for other alternatives, and this meant that most of the young people that are left at home on their own, they have so much free time on their own. So they're getting into bad company, they're engaging in vice behaviors. And at least I have from my view, I know around at least 10 young people who are now expectant, and they won't be going back to school very soon, even if they open maybe this year, because now they're becoming young teen mothers, which is so sad for our country. That is a gap already that I've seen in the system. But also on the other side, we have also had a positive element, whereby young people have come up. Like I've seen last week, I met like a group of young people. They're calling themselves on Facebook, helping the poor. So these are young people from Kenya. They're in high school, different high schools. So they came up together to support, especially the needy families. So what they do every month is that they ask their parents to support them financially. Like they give them like a small contribution. Then they map out for a needy family or maybe a children's home, for example. So they're able to buy food stuff to then take into this home. And then they just spend an entire day with this family. If there are kids there, they play with the kids. They also cook a meal together and they just share cake. So,
Thomas, if you don't mind, let me jump in here because we're just about to wrap it up in a minute or so. So, first of all, thank you very much for sharing all that, and we really appreciate it. I will also send out the link that I got from you of your YouTube story about when you went in and interviewed the family of the brother who's taking care of his brother and sister. That was a very powerful story. I'll share that link with everybody. Let me quickly ask you in a couple words, what's your next story about COVID-19? What are you going to cover next?
Okay, for myself, I'm just thinking about, because we have been having this issue, like people are not trusting the government anymore. They're thinking like money was stolen because of COVID, and there's less trust now. I just want to understand for the young people, what is their story? What is your voice? What can we do to make sure that people understand that they need to be safe, and especially safety comes first for me as a person before I can ensure that my neighbor is also safe.
Excellent. That's great. Thomas, thank you very much. And one of the things we also try to do, and I think we're going to be able to do it this time, so a big round of applause to everybody. We're going to end this right when we said we would, which is at 4:50 our time, and Christoph is closing there's the results of the thing, the one, what's it look like? 7%. It looks like the significance of WHO's recent decision to endorse testing African herbal medicines as potential treatments for the coronavirus is going to be our next topic on 7th of October. Hope you can join us, and I hope between now and then you will send out some follow-up emails, and you send us some emails about what you want to talk about, what follow-up questions you have. That's what we're here for. So, Tole, you want to wrap it up and say goodbye? Before you say goodbye, Tole, let me say thank you, Kate. Thank you, Kijala. That was awesome. And Tole, why don't you give us the big goodbye?
Thank you very much. Thank you, everybody, for taking your time and joining us. I hope you will continue going with us in this journey. We are going to have a series of these media discussions, and we are offering experts who can help you enrich your stories. Kindly use these resources, and we are available, as David said. You have our emails, and reach out anytime. Thank you very much, and enjoy the rest of your day. Thank you.